this week's humanitarian webinar. This week's episode is on the Calculus of Calamity with Professor James Shepherd-Barron. My name is Brendan Cahill. I am the Executive Director of the Institute of International Humanitarian Affairs and your host. The Institute reports directly to the President of Fordham University, and we act as a bridge between the humanitarian and the academic sectors. We achieve this through our training. We have strong programs both on the undergraduate and in the graduate side, and James will be teaching actually in the spring our online disaster management course. At the end of this session, which will be recorded, Camille Jokovas, our Research and Communications Officer, will go over where you can find that information, both on our YouTube channel and our website. I'd like to go straight into the program, really because I find Professor Shepherd-Barron to be a fascinating person. Today's event will look at the idea of disaster epidemiology, health economics, and public administration, and how these things can help save lives. So the questions that James will be asking are, who dies in a disaster? Who doesn't? Why? Who decides? And how? James himself is a former United Nations official at the World Health Organization and was head of emergencies for CARE International. Professor Shepherd-Barron is a practicing disaster management consultant with over 25 years of experience advising governments, UN agencies, the Red Cross, and NGOs. He has been a health, shelter, water and sanitation, and early recovery coordinator in 9 separate emergencies and developed the IASC Reference Module for intercluster coordination on behalf of UN OCHA. Most recently, he has worked for the UK's Department for International Development, DFID, on the cholera and Ebola epidemics in Africa and cash assistance policies in Syria. It's my great pleasure to welcome James. I'll go over very quickly. James will speak. We'll then have the opportunity for questions. So please send your questions in to the host, and then we'll wrap up. James, the floor is yours. Thank you so much for coming.
Well, thank you, Brendan, and welcome everybody, and good morning, good afternoon, good evening, wherever you are. I am in Scotland, the wonders of the internet. I've received some of the comments as you registered and raising some of the questions, which is interesting. So let me just start with a couple of quick, a quick observation, a quick comment. This is just an intro to what is an incredibly complicated and complex topic. I think you will all appreciate that. So don't expect me to answer every question. Feel free to pop them through the course of the next 25 minutes, and then I'll see if I can answer them afterwards. The second is that I'm going to be talking mostly about natural phenomena, natural hazards, and not so much about conflict, but both both categories of disaster do fit into this framework, which I'm going to discuss with you. So without further ado, who dies, who doesn't, and why? Who decides and how? Yes, it's just meant to be slightly compelling. Some of it is less obvious than it looks. I should start with some sort of averages because it provides the context. A lot of you will be familiar with this. But according to the London School of Economics, there are about 4,000 life-threatening hazards every year, of which about 1 per day go on to become disasters, i.e. affect a significant number of people and disrupt functioning of society significantly. About 100,000 people die every year. That's a jumbo jet load per day. But what's interesting is that already you're beginning to get an insight into disaster epidemiology, because in the developed world, the average is about 23 per day, whereas in the less developed world, low-income societies, it's over 1,000 per day. Last year, 95 million people were affected, and over the past decade, 1 in every 10 people on the planet have been in some way affected, either injured or displaced by calamity, catastrophe, and disaster. At the same time, i.e. last year, the world suffered 130 billion in economic losses. Interesting to note that just 1/4% of all naturally occurring phenomena that result in disasters resulted in slightly over 75% of all the fatalities. But of course, fatalities is only one metric. An awful lot of other people are affected, and we'll talk a little bit about that. And I should point out, as I was saying earlier about conflict, that today there are 41 armed conflicts ongoing somewhere in the world, and 22 complex humanitarian crises. So what is this calculus of calamity? It's an algorithm, it's an equation, it's a blueprint, it's whatever you want to describe it as. What it describes is that most of the deaths that I was just talking about are avoidable. We know, roughly speaking, in general terms, who dies, who is affected by a natural hazard event. They're not random. Certain groups of people are affected disproportionately. Women, for example, low-income urban dwellers. And geographically, we know where these people live. In general, we know who they are. We know where they live. So how do we pull that together with knowing how they died? Because actually we're not as good at that as we could be. And so the calculus of calamity is an integrated stochastic optimization model for managing disaster risk. And each of those words probably is a lecture on its own to describe what it's all about. But when I talk about we're not so good at knowing how people died, take a riverine flood in the Bay of Bengal, for example. The assumption is that people drown, and indeed a lot do. Little is talked about hypothermia, which is actually the second biggest cause of death, because although drowning ends up on the death certificate, as with tsunami, it's typically not drowning at all, but hypothermia. Scarcely mention is made of the biggest cause of avoidable death in a riverine flood, and that is snake bite. And if you know these things, then you know how to prepare for them and you know how to reduce risk of individuals. Teaching children to swim is extremely useful, but Michael Phelps cannot swim out of a riverine flood. So teaching kids to swim is not in itself as useful as teaching them how to do CPR and making sure that primary health services have antivenoms and snake trays available. So that's a kind of example of how a disaster risk is managed. In terms of stochastic optimization, well, I said earlier that it's complicated and complex. There are over 2,300 risk factors that determine the outcome of any single hazard event. Each of those changes and interacts with the other over time. And so that's what we mean by stochastic in this sense. I'm sure there are more sophisticated descriptions of what it really means. And yes, this is a concept, a model that reframes how what we have always been trained in disaster management terms of risk and hazard and vulnerability. It reframes this, it puts it in a slightly different, dare I suggest, more sophisticated algorithmic sort of sense. And when I say algorithm, I don't particularly mean that it's quantitative, it's qualitative too. But we might come on to talk about that later. And I've deliberately left the last word to the word integrated, because what I'm discussing here is a sophisticated model of disaster management, which is based in the entire risk reduction narrative, introduces, though, elements which individually we know more or less about, depending on the discipline that we come from. What is generally missing, and in my experience has been missing for 25 years at least, is a wider embedding of health economics, disaster epidemiology, and the basic tenets of public administration, and embedding them into something that we can actually use. I hope you can see all of that slide. It's not meant to frighten you. I call it my capital slide. But you can see at the bottom that the base of this building, it's meant to be a sort of building, a Parthenon, if you like, is about disaster risk reduction. It talks about the drivers of risk, ecological change, population growth, and then the bits that the Calculus of Calamity, being a disaster management tool, an optimization tool, bring together are the components of hazard, epidemiology, vulnerability, economics, exposure, and resilience with disaster management. Now, I'm not saying that everything else is not part of it. It is. Environmental risk, which you can see up at the top in one of the thunderclouds, is absolutely part of the risk model. But disaster management is generally seen as being a subset of the whole disaster risk reduction enterprise, because it deals with the here and now. It deals with an event and how we deal with it. I would argue, and I'm certainly not alone, that disaster management actually is disaster risk management. They are one and the same thing, i.e. you are involved before, during, and after an event. If you are a disaster manager, you don't just fly in and manage. This is what the Calculus of Calamity actually looks like. It's pretty ugly, I agree. In broad terms, disaster, catastrophe, calamity, the delta sign on the left, is a function of hazard, risk, vulnerability, exposure, resilience, and I put M for management here, and the theta sign, which is to do with the econometrics of the managing of it. Let me go through each one, if you'll allow. So, what is a disaster? What is a calamity? Basically, it's a social construct. It's the result of decisions we take or don't take. They are not acts of God. They happen when hazards collide with human behavior. I think the proper definition is to overwhelm local coping capacities. There are other criteria to do with how many die and whether external assistance has been requested. But that's the broad outline of a disaster, and there are over 300 different categories. Technological, environmental, for example, biological, and complex man-made disasters, as well as just the natural. 300 types, it's a lot to get your head around. It's not just earthquakes and volcanoes. I group hazard and risk together. This is not so special until I say that the R for risk, for me, depicts something which is relatively new, which is that risk is itself a risk factor. Because humans are so poor at perceiving risk, just ask the Arnie Schwarzenegger, who, when the Japanese earthquake threatened to send a tsunami into San Francisco, asked everybody to run to the hills. Half of San Francisco went down to the beach to watch. Disasters are the result of human behavior. And so risk and how we behave and how we perceive and what our tolerance for risk is in itself part of the hazard type, if you like. In terms of hazards, we have to understand that impacts are short-term and long-term. The onset of the disaster might be sudden or it might be slow. Droughts, for example, kill more people consistently over decades than any other form of disaster, including floods. But those different types of hazard all interact and often have multiple knock-on effects that cause others. And not only that, the impacts go on way, way beyond the initial event, typically a decade or more. The Kyoto earthquake, I can't remember the date now, towards the end of the last century anyway, took 12 years before the last family was rehoused. But it gives you an idea of how long the recovery period is. So there are indirect and direct effects as well, so that in the Yogyakarta earthquake 2006, for example, which I was at, an indirect effect, for example, would be tetanus, as many people died from tetanus as actually died from building collapse. So once you know that, then you know that you have to prioritize some form of anti-tetanus vaccination. If I go on to talk about vulnerability, exposure and resilience, they're in this sort of bracket because they're kind of, if it's possible, they're three sides of the same coin. Vulnerability is not the same as exposure. All old people are not vulnerable necessarily. People living on the second or third floor of a multi-story building when a storm surge comes through are not necessarily exposed. And those on the ground floor and those on the second or third floor may or may not be vulnerable. Either way, if vulnerability and exposure are two sides of the same coin, then the more you build individuals, families, communities' resilience, the less people are going to be affected by being vulnerable and by being exposed. And that's why you have vulnerability and exposure divided by resilience. If I look at the management side, I'm not going to go back to the slide we had with the capital on it. But in the box marked management, it had the word coordination. Those of you who are used to the UN system will be used to the cluster approach, which is a consensual management coordination approach. This, to my way of thinking, is a subset of disaster management, because disaster management has legal implications, quite apart from moral and ethical implications, because governments and local authorities are responsible for the safety of their people, not you and I, who don't live there, but try to help before, during, or after. Coordination is a subset of a wider model of disaster management, and there are many, many different models. Consensus management is only one. The theta there refers to the economics of the model. So the most obvious example of that would be, for example, a QALY. If you are a disaster management team member or you are leading a team, somebody somewhere will be talking to you about costs and benefits and quality adjusted life years, or micromorts, or any other econometric which public health people like to use. Why? Because it gives you some steer as to the efficacy of whatever approach it is that you're discussing. And you need to be able to do that because you're going to have to make some tough choices. Because as we all know, it's very nice to think that life has infinite possibility and infinite meaning, But in practical terms, you don't have unlimited resources. You have to prioritize, and therefore you've got to make choices. So if you want to talk about cost benefits of a given intervention, it's best to neutralize it by talking about the cost per QALY averted, for example. That would be one. If you're talking about management, people will want to talk to you very quickly about whether a field hospital should be mobilized, whether urban search and rescue from neighboring countries should come. And the answer is, well, think about it, because on average, a life saved from a mass casualty event in an urban area with building collapse is going to cost you at least $500,000 per life saved. And even here, that's a false metric, because there is an idea in public health terms called happy smiling death, because about, last time figures ever put any data onto this, about half of everybody who's pulled dazed and smiling from the rubble of a collapsed building after an earthquake go on to die within 2 or 3 days, because we haven't got the capacity, we haven't mobilized the right capacity to deal with a perfectly avoidable cause of death, which is due to crush injuries and all the rest of it. Now, nobody's saying that a disaster manager is expected to know all this. But the point of all this is that anybody in a disaster management team needs to know, and know systematically, and know across multiple disciplines. I think there are, what, 13 clusters now, for example, 13 sectors of work, and across multiple dimensions of economics and public health and business administration, public administration. People have to know how these all fit together. Now, I think I'd probably leave it there, because there may be some questions you want to ask me about how you measure some of these things, because this looks like an algorithm. It looks like something that is quantifiable. It is, but you have to make gross assumptions on each metric. So when you look at the, let me just toggle back through, when you look at each metric, there are 300 different categories of disaster, of hazard. There are many different types of risk. There is much you can do to build resilience through enhancing early warning systems, education, first aid training, and then the lesser known things like, has anybody provided credit for the shopkeepers, for the wholesalers, who are probably not in that country but in another country? Who was involved in risk mapping? Was the entire community involved in that, or just authorities? These all have a bearing on resilience. Exposure, if you are dependent for a job on a single industry and that industry collapses either because the supply chain is affected or because the building in which you work has collapsed, you're going to be much more vulnerable than somebody in a town where there's lots of different ways of earning a living. To what extent does inequality in terms of vulnerability, inequality of income, make a difference to whether you live or die? And how do you measure that inequality? Well, there's a Gini coefficient. You could use that. All of these symbols here can all have numbers ascribed to them. Educational attainment. There are, in fact, 2,400 different risk factors, and the Calculus of Calamity asks us to look at 60. At the moment, most disaster management trainings look at about 20, if that. But there are at least 60 that need to be looked at consistently. So I'm happy to take any questions. I think I'd just sort of like to finish by bringing in the words multidisciplinary. This is a multidisciplinary approach. It's multimodal, it's multidimensional, it's complex, and it's complicated. Disaster management is probably the most difficult job on the planet. Just ask anybody who's done it. So I'm teaching a course on it. If you'd like to know more about that, please come along. Thank you. Brendan.
Thanks, James. James, maybe if we start from a bird's eye view, which is, you know, with 25 years of experience, what do you consider in your specific case was, you know, the greatest skill that you brought to bear in going to very different types of disasters? What brought them together for you, and how did you assist, if you could, in that management?
It's interesting because most people in disasters, in one shape or form, stick in their comfort zone. It's only natural. People work in food security their entire lives. There are very few people who do disaster management full time as a profession, although that is growing because the Sendai framework asks for disaster risk governance to be mainstreamed because it's acknowledged that people have this rather siloed approach to their work. I consider myself personally to be quite lucky because I'm trained in public health and international disaster management and epidemiology, and I get a spread. So I've managed shelter clusters, early recovery clusters, health clusters, water sanitation clusters, this kind of thing. So I've seen the spread, and I've been surrounded by people who don't have the benefit of the breadth of experience of other sectors of work. The second bit is that there was a moment in my life when I personally had to choose, what am I going to upgrade my skills in? And so I chose international health, often now called global health or population health, because I thought, based on, I suppose by then about 10 years experience, that everything I was seeing around me was basically either protection, and I wasn't a lawyer, or a public health challenge. In one shape or form, providing shelter, the impact of that is thermal protection. The outcome is how much neonatal tetanus there is 9 months after the event, because there's always a baby boom. But nobody was seeing shelter in public health terms, and to an extent they still don't, because, not being rude about anybody or to any sector, but you tend to be talking to builders, engineers and architects. They just don't think about qualities. They've never been trained in them. They don't see that. So somebody in the team has to have this broad view and then have enough gumption. I don't really like the word leadership because it gets overused, but enough broad vision to know when to ask the difficult question, to whom to ask that question, and how to delegate the responsibility for dealing with what comes out of asking the question.
And can I just push back there, which is, yes. Do you think that in today, in disaster management today, as compared to 20, 30 years ago, do you think there is a role for that person today? Do you think you're given that authority where you might have been given that 25, 30 years ago?
No, I think it's coming. I think it's yet to come. The Sendai framework is very clear in its priority action number 2. It looks for enhanced governance in disaster risk management, because they realize that management is arguably the biggest risk factor of them all in determining who dies and who doesn't. And a 5-day training does not qualify you to be a disaster management manager when you're dealing with 2,400 risk factors, 300 types of disaster, et cetera, et cetera. It's complicated. And so since I started, and certainly in the last 10 years with Hyogo before Sendai, governments are under the spotlight because they have to build these capacities, and they are. When I worked in Pakistan in 2005, in the earthquake, there was no National Disaster Management Authority. There is now. And in fact, within 7 years, they said, well, we don't really need you anymore, the UN, thank you very much. I think we can handle this. And so the capacities are being built everywhere. The next challenge I see, and I saw it most recently with Hurricane Maria in the Caribbean, is that those who are professionals in the Caribbean, it's a whole sort of CARICOM joint endeavor. There are fantastic people, as there are in the Philippines, but any sizable disaster, they're very quickly overwhelmed. The capacity in depth does not exist. So more people need to be trained wider and deeper. And yes, they are being given the responsibility by their governments to command, to control, to direct, to take life and death decisions. So yes, it is happening, it is accelerating, but there isn't enough of it, it isn't deep enough, it isn't wide enough, in my view, and the capacities are not enough.
Great, thanks, James. I think we'll go to questions from the floor now. From Jim Van Putten, is there an example of this calculus of calamity in action in which the outcome is improved, and or he continues, or maybe portions thereof that have been employed to improve the outcome? So could you give an example of how applying this calculus will improve disaster management?
Yes, the short answer to Jim is no and yes. As the calculus stands right there, it's a model, it's a construct. If you take, and this is how I got interested in all of this 10 years ago, the UN flew me into Hyogo to look at the aftermath of the, or to help advise on the aftermath of the tsunami, the Great Japanese Tsunami. And in the margins of that, we had a conversation about earthquake risk and building collapse and the threat posed by dust inhalation. Being squished in a building collapse is bad enough. Dying of blood loss is bad enough. About 85% of people in a collapsed ferroconcrete building die within about 15 minutes, but there's significant numbers of people, depending on the time of day, et cetera, who don't. But they die because they've inhaled concrete dust. Same in Kathmandu in the Nepal earthquake of 2015, inhaling brick dust. Different dynamics of collapse, of course, but dust inhalation becomes a risk factor in its own right. The Japanese changed their law a few years later so that every helmet, which is by law behind every hotel room in the land, now has a dust mask in it. Because they typically, in Japan, their geophysical threat gives the people of Tokyo about 63 seconds to get out of the building. They can put a helmet on in that time, and they do. If they can do that, they can put a dust mask on too, because if they don't make it out and the building collapses, some people who would otherwise have died of dust inhalation do not. That costs 20 cents per mask. I would argue that that's maybe a cost-effective intervention. So I hope that answers Jim's question. But as a whole algorithm, not yet. I'm hoping that it will be developed so that one day it might.
Great. Here's a question from an economics PhD at Fordham. She or he writes,
oh dear.
My dissertation explores the impact of disasters on risk preferences in Indonesia. I found that measuring disaster severity by mortality shows the highest impact on people's risk attitudes. I wonder if you have any opinions on why death would be more salient to individuals than other measures, such as damages, destruction, evacuation, or meteorological measures.
Gosh, what a good question. It's highly emotive, isn't it? the fear of death. But then you have all sorts of effects, don't you? You have recency effects. You have survivor biases. Your neighbor who survived the last one survived. And so you think, gosh, they must have known something. So you'll listen to your neighbor more than perhaps you should. So these things are nothing to do with death, but they're the obverse, they're the other side of death, i.e. who did not die and why. Because we make so many false assumptions in that calculus. You look at the superstorm Sandy, not that many people died in the end, but enough did, and more than one is a tragedy. And if it's avoidable and preventable, it's more than a tragedy. So no wonder everybody will start couching the event in terms of death. But two things happened. Firstly, Con Ed was sued for not switching off the electricity because too many people were electrocuted rather than drowned, in a case which I think has now been resolved, but some good New Yorker can put me right. But it's the beginning of, it's the start of a trend. The things are going to show more, there's going to be more litigation in this area going forward for sure, because ignorance is no longer a defense. And at the same time, you had people who, having survived, then were knocked sideways by all sorts of longer term effects, which they survived initially, but suddenly their house is full of mold and they've got respiratory infections going on for years and years and years. And this happens all over the world. It's arguable, I don't have the data, I think it's a bit of perhaps a rash thing to say, but it is arguable that more people die from the indirect effects of a hazard event than the direct ones over a much longer time period, so it goes unseen. And mortality is instant. It's the media can get their heads around it. Whether it's a false metric or not is certainly debatable.
Jim, how do organizations decide who to help and how much to help for each individual disaster? Is it quantitative? Is it debated? Is it subjective?
It's not debated nearly enough. It's far too subjective. There's not nearly enough objective analysis of the risks, the underlying causes, the real underlying causes, the drivers. There's not, in my view, there's not nearly enough of the elements that come after in such a thing. So you've basically got to look at some kind of cost benefit measure at somewhere down the line, because the whole thing is about allocating scarce resources. It's about allocative efficiency. You don't have enough to save everybody. So it's Sophie's choice. What are you going to do? Well, presumably you're going to do that which is most cost effective. But then there are elements of time and quality, of course. And who decides? Well, the government tries to. Are they fully functional? No, they just lost their family members in that disaster as well. They're not functioning properly, probably. Were they functioning before? Well, they probably don't have the capacity, even in the Philippines, even in Indonesia, countries that get hit repeatedly. A lot more capacity than they used to have, but it's still not enough to cope with everything they throw at you. So a tricky area for sure.
What do you think are some best practices for engaging local governments when responding in times of crisis? And how do you ensure that the response practices you put in place remain sustainable after you leave?
Yeah, you make it sustainable by building their capacity. And when you go in, if you are responding and you're coming in from outside, as I as a Westerner normally am doing that, you do not accept that the ministry counterpart hands the meeting over to you. No, it's your meeting. It's your country, it's your people, you do it. I will sit behind you and walk you through how to do it. But you've got to take responsibility for this. It's no good handing it over. For a very long time, we've been very happy to it's the whole sort of concept of charity and non-governmental work. We're all very happy to take these responsibilities in a rather sort of, I don't know, maybe slightly neo-colonial approach, but we don't have to anymore. There are plenty of good people in government. They just need to know that they're supported and that somebody will help them work out with other stakeholders, donors with their particular agendas, NGOs with their mandates. You know, it comes down to who's got the chutzpah to say no. It's not about getting to yes, it's about saying no. And on what basis? Because it better be based on evidence. And please, somebody don't ask me a question about what is evidence, because that's questionable too.
What role do you see disaster epidemiologists playing in the coming years, especially regarding the climate crisis and COVID? What aspects of disaster epidemiology do you think need improvement? And where do needs assessments fit into that equation?
Disaster epidemiology is at the broadest scope, way beyond disease surveillance and that kind of thing, but it plays a role in providing information at a whole bunch of levels which have nothing to do with medicine and public health that together work towards giving you some kind of measurement of what's working and what isn't. In my experience, and this certainly was the case in the UK as I watched the COVID crisis unfold over the last few months, having worked with CDC Atlanta people and Public Health England people and many others from WHO and elsewhere in the Democratic Republic of Congo for the Ebola crisis, the same thing happened there, is what, 2018, as happened in London and Madrid and elsewhere in 2020, and New York probably, as happened in Sierra Leone in 2012 with cholera, which is that epidemiologists find it really difficult to deal with uncertainty. And disaster managers have to make decisions all the time with noisy, fluffy data, which may or may not reflect what's actually going on. But you can't wait for your peer review, which might take weeks, it normally does, months if you're getting it published, but you've got hours, minutes, you can't wait. You have to take decisions. And so getting an epidemiologist to see the problem, not just as a nail because they only have a hammer to wield, but a much wider construct is one of the biggest challenges. I happen to think, but I wouldn't I, because I guess I am an epidemiologist in one sense, a disaster epidemiologist, it's the key to it. It's the key to information management. It's the key, therefore, to performance management. Allied with economics, it's the key to prioritization and tracking how things are changing over time. One way or the other, a lot of what we call information management in a disaster is actually epidemiology.
I have two interesting different ones. Maybe I go to resiliency first. Measures of resiliency for individuals and families in more developed countries is usually easier to determine based on destruction level, insurance status, location, etc. What are effective measures of resiliency in developing countries to assist in determining greatest need? So what kind of measures can you put in those countries that perhaps are more developing?
I think I mentioned some of them. I mean, first aid training is a classic. The more people you can train in your street, in your neighborhood, in your community, in first aid, the better. But you need to go further. If you live in a part of the world prone to hazard risk, you will know who you are. You know, the people of Kathmandu fear the next earthquake. I'm sure the people of San Francisco do too. First aid isn't enough. Knowing how to staunch a wound, yeah, very helpful. But when you know that hundreds of people pulled out of building collapses are paralyzed in the course of their rescue because nobody understands how to immobilize what is then a patient. And that person then goes on to die because they haven't had renal dialysis in situ or oxygen or whatever the medical treatment is. I'm not going to pretend that I can even comment on the medical side of it. Then that's second aid. You actually need to go further than first aid. I talked about snake bite. CPR on an infant is not easy to do, but and the primary health center is hours away probably. When I first started out in this business, I worked with a guy who left the WHO to set up an NGO. He did CPR with a soldier he'd never met for 12 hours. And the patient became the Deputy Minister of Health in that country, you know, years later. So knowing how to do CPR on your sister in the Sundarbans of Bangladesh is a good idea. Highly cost effective and will save probably more lives than teaching people to swim will ever do. Not that teaching people to swim is not a good thing to do, it is. Yeah.
So from David Rubens, we have one, which is, do we need a new mode of disaster modeling and crisis response management to match the hyper-complex situations we're now seeing? Or do the language modeling and metaphors that we were using in 1995 or 2005 still stand as valid and applicable?
Oh, I think they're still valid and applicable. The calculus of calamity is just a new way of putting the metrics together. All it's trying to do is say there are more dimensions to this management process than first appear. We're in 2020 now. We know more. Well, a little bit of hubris here maybe, but yeah, we do know more. And therefore we are expected to not just ignore stuff. So none of the words that I've used are in any way new. They're not even cobbled together in particularly new ways. What they do is add them together in a way that disaster management teams can systematically go through all of the risk factors that are pertinent to that crisis, because every crisis is unique, and do it again and again and again. It's a multidisciplinary approach across many sectors of work. It's multidimensional because you need to know about economics, you need to know about public health, and you need to know about the finer dark arts of administration, you know, resource mobilization and all the stuff you have to do that nobody ever actually thanks you for. That's not new, but you have to do it consistently, coherently. And yes, I do think that we owe it to those we serve, we owe it to ourselves. We owe it to not being sued, because you're going to have to protect yourself one day, that you took the right decision and you didn't just react on instinct, because that's no longer enough, in my view.
I think I'm going to stop the questions there. But James, I would ask that you, from the questions that have bubbled up today, are there any last words that you'd like to give us, you know, to finish this off?
Oh. what did I wrote something down along those lines, if I can find it, because it behooves me to get it right. I think in summary, if there are 300 types of natural hazard, if management involves, I haven't mentioned this, 157 core competencies, and it does, and brackets, the cluster approach teaches about 15% of them, and some of them not very well, close brackets. And if there are 2,400 risk factors that determine who dies and who doesn't in a disaster, then that will overwhelm everything and everybody. Nobody's trying to do that. What the Calculus of Calamity does is put cohesion into a finite number, 60, of those risk factors, and look at key core competencies required of a disaster manager, which I haven't gone through in any detail, but I mentioned the word credit. Do disaster managers know what a catastrophe bond is or how to negotiate one? If you don't, you need to know, or you need to know who to ask, because it's on your watch and you have to make sure it's done and looked at. So systematic, multidimensional, multidisciplinary approach with a simple equation. That's all this is.